Manual muscle testing was designed to evaluate patients with a lower motor neuron disorder, manifested by flaccid paralysis or weakness. When patients lack selective control, that is, the ability to move one joint without being obligated to activate movement in adjacent joints, then manual muscle testing often yields spurious results. The upright motor control test provides an alternative mechanism for assessing lower extremity function and strength. One examiner and an assistant are required to conduct this evaluation properly. The patient must be able to understand and follow simple instructions and require no more than the assistance of one person for either single or double limb stance. The test has two major sections, the flexion control test and the extension control test. The flexion control test ascertains flexion control of the non-weight-bearing extremity for an activity such as limb advancement in the swing phase of gait. An assistant provides manual balance support for the patient on the side contralateral to that being tested. If both lower extremities are involved, then support of the contralateral leg may be required to ensure stability. The examiner demonstrates each test part as many times as necessary to ensure patient understanding. The patient is then allowed no more than 2 practice trials to avoid fatigue. Only 1 graded trial per limb segment is allowed. Just prior to the graded trial, the patient's test limb should be positioned in neutral at both hip and knee or in the maximum available extension range. During assessment of hip flexion, the patient is asked to bring their knee up to their chest 3 times as high and as fast as they can. The rate at which the 3 repetitions are performed, as well as the peak angle of hip flexion during the 3rd attempt, are critical features when grading hip flexion control.
Stand as straight as you can. Bring your knee up toward your chest as high and as fast as you can, 3 times.
During assessment of knee flexion, the patient is asked to bring their knee up toward their chest 3 times, as high and as fast as they can. The rate and amount of peak knee motion is evaluated.
Stand as straight as you can. Bring your knee up toward your chest as high and as fast as you can, 3 times.
During ankle dorsiflexion assessment, the patient is asked to bring their knee and foot up toward their chest 3 times as high and as fast as they can, while the examiner observes the ankle posture. The criteria for grading the ankle control focuses on the peak angle of dorsiflexion achieved and the rate at which the movement is performed.
Stand as straight as you can. Bring your knee and your foot up toward your chest as high and as fast as you can, 3 times.
The extension portion of the upright motor control test ascertains control of a single weight-bearing extremity for an activity such as single limb stance in gait. The starting position is double limb stance with both limbs in neutral alignment or the patient's maximal available extension range. The non-test limb is lifted from the floor by either the patient or an assistant. If the patient has a fixed equinus contracture that is greater than the neutral ankle position, the contracture must be accommodated by placing a hard wedge under the heel. The purpose of the wedge is to align the tibia into a vertical position. If a stable plantigrade platform cannot be maintained with a stable support or with an ankle-foot orthosis, the examiner should give a score of unable to test at the hip and knee. For example, if excessive tone precludes the foot from assuming a position flat on the floor, the extension control test cannot be conducted. Hip extension control is assessed with the examiner next to the patient to offer hand support and to ensure that the patient begins from a position of neutral alignment or from the patient's maximal hip extension. The assistant provides manual stabilization to maintain neutral knee extension and a stable ankle. The patient is asked to stand as straight as they can on the test limb while the opposite limb is lifted. Stability of the hip during single-limb stance is the criteria of interest during grading.
Stand on both legs as straight as you can. Now, stand as straight as you can on just your right leg. Lift this leg up. Keep standing as straight as you can.
Assessment of knee extension control starts with the patient's knees in 30 degrees of flexion bilaterally. The assistant provides hand support for balance and to maintain the trunk erect on the hip. The patient is asked to first try to maintain their stability on the flexed test limb while lifting the opposite leg from the ground. If the patient can support body weight on a flexed knee during single limb support without collapsing into flexion, then the patient is asked to straighten the knee. The ability to perform progressively more demanding stability tasks at the knee determines the final grade awarded.
Stand on both feet with your knees bent. Keep your knees bent and lift your left leg. Straighten your right leg.
The ankle plantar flexion test assesses the ability of the individual to control their ankle and tibia during stance. If the patient has a plantar flexion contracture, it should be accommodated by placing a hard wedge under the heel. When performing the test, the assistant maintains the trunk in an erect posture over the hip. The examiner prevents knee hyperextension, that is, ankle plantar flexion. The patient is initially asked to stand on the test limb while lifting the contralateral limb from the ground. If the patient can control the tibia with the knee in neutral, proceed to ask for a heel rise while the knee is kept neutral.
Stand on both legs as straight as you can. Lift and hold up your left leg. Keep your knees straight and go up on your toes as high as you can. Relax. Again, I want you to stand as straight as you can. Bring your knee and your foot up towards your chest as fast and as high as you can, 3 times. So I want you to try to stand as straight as you can, and I'd like you to lift your left foot off of the ground.
Oh, sorry.
Stand as straight as you can again for me, and lift your left foot off of the ground, please. I'd like to try this once more. I want you to stand as straight as you can, and you can use my hand for more support when you lift your left foot off the ground. So go ahead and lift your left foot off the ground, please. Okay, thank you. I want you to stand on both feet with your knees bent. Go ahead and come forward. Okay, and you can go ahead and come back up. So I'd like you to stand as straight as you can and try to lift the left foot up off of the ground. Try again, please. I'd like you to stand as straight as you can. Lift your left foot off of the ground and hold it for me. Can you go up onto your right toes? Go up onto the toes of your right foot. Okay, thanks. I'd like you to bring your knee and your foot up towards your chest as fast and as high as you can 3 times. Okay. Good. Stand as straight as you can and bring your left foot off of the ground for me. Good, you can put your left foot back down. I'd like you to go ahead and stand on both feet with your knees bent. Good. Lift your left foot off of the ground, keeping the right knee bent. And now straighten the right knee for me. Good job. Thank you. Go ahead and put your left foot down. I want you to bring not only your knee, but also your foot up towards your chest as high and as fast as you can 3 times. Okay, thank you.